What do you think about cancer?
Cancer. That word.
That word.
What does cancer mean to you?
What's the first thing that comes to mind?
Being bald and sick.
Taking my grandmother to the hospital. Chemotherapy.
It's why I became a doctor.
Hope.
A disease that's taken too many lives.
I've been through chemo and it hits you like a sledgehammer.
I was diagnosed with Hodgkin's lymphoma in middle school.
My dad was affected by cancer. He was a survivor until he wasn't any longer. Every time I treat a patient with cancer, it's another opportunity to help somebody like my dad.
Cancer doesn't discriminate according to age,
race, or ethnicity.
And cancer affects people of color at an alarming rate compared to the white population.
According to the National Cancer Institute,
Black men and women have the highest rate of getting and dying from cancer.
The disparity isn't just in the Black community.
Hispanics have the highest rate of new diagnosis for cervical cancer.
Asian and Pacific Islanders
have the highest rates of stomach and liver cancer.
when compared to other races,
Black men are more than twice as likely to die.
Twice as likely
to die from prostate cancer.
But we can do something about it.
We can do something about it.
You
Can do something.
Cancer clinical trials.
The National Cancer Institute, or NCI, is a publicly funded agency of the National Institutes of Health.
That conducts many types of clinical trials.
Cancer clinical trials are how the medical community improves cancer treatment.
Trials lead to new medications, new treatments, and new guidelines for care.
Every major treatment for cancer
Was once tested in a trial.
The types of trials that the NCI runs includes treatment, screening, prevention, and supportive care.
They're done with the utmost respect for our patients on the trial.
Respect for the patient.
With certain types of cancer affecting minority groups differently.
We need trials that research this.
And people to take part in them.
Because right now, very few
minority cancer patients
enroll in clinical trials.
By not being in these trials,
We aren't reflected in the findings.
We need research
And results.
that represent everybody.
Everybody.
Trial enrollment.
as diverse
As a U.S. population.
So the medical community can find answers that speak to all of us.
All of us.
All of us.
in the Black community, there's been a long-standing mistrust of the medical system.
From 1932 to 1972, the Public Health Service wrongfully and unethically conducted the Tuskegee experiment.
Black men were misled into thinking that they were being treated for syphilis.
They actually didn't receive any treatment.
People were not respected.
And people were seriously harmed.
But from this awful experiment came many of the laws and regulations
That protect people in clinical trials today.
Today, clinical trials follow strict protocols and ethical guidelines.
They're done with close supervision and rigorous oversight.
To keep patients as safe as possible.
If we're going to improve cancer outcomes for our communities,
We need you.
It starts with you.
You.
If you
Or someone you know has cancer,
Ask your doctor if there's a trial for you.
You just have to ask.
so you can help improve future cancer outcomes. In the Black, Hispanic, Asian, and Pacific Islander communities.
For more information on how you can be part of the change, go to